Bone spurs on your x-rays could be a sign that your scoliosis is actually progressing. See, it's thought that bone spurs form as a mechanism to try and stabilize the spine. But one study found that unilateral osteophyte formation, or bone spurs, on the concaver inside of a scoliosis was actually associated with spinal instability and an increased risk of your curve progression. Hi, I'm Dr. Chris Gubbels. I'm a leading authority in the non-surgical treatment of scoliosis and the head scoliosis clinician at ScoliCare Denver. Now, if you're an adult with scoliosis and you haven't already downloaded our free ebook called Scoliosis Knows No Age Limit, be sure to do so by clicking on the link below. So what is a bone spur? Bone spurs, are also known as osteophytes, are these small bony projections that form on the edges of bones, especially in joints that are under stress, like those in the spine. They're your body's way of creating stability when things start to break down. Think of them as your spine's way of trying to splint itself. Now, what causes a bone spur? Bone spurs typically form due to long-term joint stress from things like repetitive motion or unbalanced forces on the joint from things like misalignments like those you see in scoliosis. These misalignments will cause the body to deposit extra bone in an effort to try and protect those areas. Now, this can also happen due to loss of cartilage, leading to more force on the bone. This is what happens in degenerative disc disease that we see in scoliosis. In fact, degenerative disc disease and disc wedging may be what triggers or starts degenerative scoliosis in adults. Now, in scoliosis, as the curve progresses, uneven pressure on one side of the spine accelerates degeneration, frequently leading to bone spur formation. Now, bone spurs can also develop in areas of spinal instability where the joints have excessive motion. In fact, one of the biggest predictors of progression in degenerative scoliosis is something called a lateral oleolisthesis. This is when one of the bone shifts or slides off the other bone. This lateral shifting is a sign of segmental instability. That is when the spinal ligaments can no longer hold the spine in proper alignment. Bone spurs may form as an adaptive mechanism to attempt to stabilize the unstable spine. Now, how do bone spurs actually affect the spine? You see, flexibility is one of the most important factors in scoliosis treatments. Here's the real issue. Bone spurs reduce spinal mobility. Once they form, those parts of the spine become rigid, even fused in severe bone spur formation. And that changes everything when it comes to scoliosis treatment. You see, less flexibility equals less or fewer options when it comes to scoliosis treatment. Now, we can actually measure spinal flexibility by taking lateral bending x-rays when viewed from the front or behind. Spinal flexibility is really determined by how much of the curve in scoliosis reduces when someone laterally bends. For example, if a curve only reduces a few degrees or less than 25%, that'd be considered a very stiff spine. If a curve reduces maybe between 25 and 50% of the curve, that's still considered a stiff spine. If a curve reduces between, like, say 50 and 75%, we consider that mild stiffness or even a flexible spine. And if a curve reduces more than 75%, we would consider that a very flexible spine when we're thinking about scoliosis. Now, the stiffer the spine is, the harder it is to reduce the size of the curve or to reduce the postural collapse. So if a curve is really stiff, we may have to work on specific treatments that actually work to enhance spinal flexibility. For example, if a patient is coming in for scoliosis-specific rehabilitation and bracing, the scoliosis rehab or ScoliBalance in the beginning is really going to be geared towards increasing mobility in the spine. This will help actually prepare the spine for a custom brace. Now, let's say someone is not doing bracing, but they are looking at surgery. The amount of flexibility in the spine is the biggest predictor and how much the surgeon can reduce the size of the curve with surgery. So if someone has a very stiff or rigid spine, they may order or request some specific rehab or scoliosis-specific rehab that really works on increasing mobility in the spine. Because if the spine is more flexible and more mobile, the surgeries like to be more successful or to get a better correction with diffusion. Now, if there's really severe spurring and there's no mobility at all, the surgeon may actually perform an osteotomy where they go in and actually remove the bone spur to help improve the amount of correction they can get with the surgery. So bone spurs are really common in people with degenerative spine disease, especially in degenerative scoliosis. And they can be thought of as the body's ability to attempt to try and stabilize the spine. So if you have bone spurs, that tells us the spine is likely unstable, and bone spurs can be seen as a risk factor or a predictor of spinal progression. Now, if you're watching this video and you have degenerative scoliosis, or you're an adult with scoliosis, and you're wondering what can be done to possibly treat this, click on the link below and request a free discovery call. That's going to give you a chance to talk to me one-on-one about your individual scoliosis. We'll go over the severity of the scoliosis, how big it is. We'll go over the likelihood of your curve progressing or continuing to get worse, and we'll go over what treatment options you may be a candidate for. But now that you know more about degenerative scoliosis and bone spurs and degeneration in scoliosis, to learn more about the most effective treatments for adults with scoliosis, click on our next video, and I'll see you there.